Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In this video, we will go over some important practice questions from the remaining nervous system topics, along with guidelines and quick elimination methods, so you can choose the correct option within a minute. So, without further ado, let's get started. Pre and post-operative diagnosis increased intracranial pressure and cerebral edema due to severe brain injury. The scalp was clipped and the patient was prepped with chloropep and betadine. A 10 cm incision was made and a self-retaining retractor was placed. A hole was drilled with a cranial twist drill puncturing the dura. A brain needle was used to localize the ventricle requiring the three passes. The cerebrospinal fluid was clear and colorless with high initial pressure that tapered off due to brain swelling. After two attempts, the ventricular catheter was placed into the ventricle, exiting through a separate puncture site. Intermittent cerebrospinal fluid drainage was noted. The catheter was secured with two silk sutures and incision was closed with ethylone sutures. The patient tolerated the procedure well. Sponge and needle counts were correct and blood loss was minimal. What is the correct code for this surgery? Option A with code 61107, 62160. Option B with code 61210. Option C with code 61107. Option D with code 61210, 62160. In this scenario, we choose the correct option based on the surgical approach used. In this scenario, a twist drill was used to create a hole in the skull to access the space between the ventricle to place a drainage catheter and measure intracranial pressure. Based on the surgical approach, our correct option is option C with code 61107. We eliminate option A with add-on code 62160 as we use this code when a small endoscope is used to access the brain for placing a ventricular catheter. In this scenario, no endoscope is used. Both option B and D are incorrect because the codes in these options are used for pearl hole procedures. A 40-year-old patient has undergone neuroplasty on the wrist for carpal tunnel syndrome. The palm is opened through a curved incision and further skin flaps are developed. The ulnar origin of the transverse carpal ligament is divided, decompressing the carpal tunnel. Tensions on the nerve is released and the incision is sutured in layers. What CPT code describes this procedure? Option A with code 64721, Option B with code 64719, Option C with code 64708, Option D with code 64704. In this scenario, neuroplasty is performed on the wrist for carpal tunnel syndrome. Carpal tunnel syndrome is caused by a pressure on the medial nerve in the carpal tunnel of the wrist. Therefore, for carpal tunnel syndrome, the correct option is option A with code 64721. Option B is incorrect because code 64719 is used for neuroplasty of the ulnar nerve at the wrist. Codes in option C and D are used for neuroplasty performed on the nerves of the arm, leg, hand, or foot. The patient with an obstructive ventriculoperitoneal shunt presented today for the shunt revision. After inspecting the shunt system, the entire cerebrospinal fluid shunt system was removed and a similar replacement shunt system was placed. The patient has normal pressure hydrocephalic. What CPT code describes this procedure? Option A with code 62180, T85.192T. Option B with code 62258, T85.09X T. Option C with code 62256, T85.09X A. Option D with code 62190, T85.199 A. In this scenario, a shunt revision is performed. First, we can easily eliminate option C and D based on 7th character A used with the diagnosis code, which is designated for the initial encounter. Revisions mean it is not the initial encounter. The patient has already received the active treatment. This is a subsequent encounter indicated with 7th character D. which occurs during the healing or recovery phase. As in this scenario, the shunt system was removed and a similar replacement of the shunt system was placed. The correct option is option B with core 62,258. Option A is incorrect because core 62,180 is used for the initial placement of the shunt. Phyllis fell down on the ice and fractured her leg. The fall also caused severe injury to the muscle and tore severe nerves. Her physician completed suturing of two major peripheral nerves in her leg without transposition and shortened the bone. After the surgery, she was seen by the physical therapist for ongoing treatment and gait training. How would you report the surgical procedure? Option A with core 64,857, 64,859 along with modified 51, 64,876 along with modified 51. Option B with core 64,856, 64,857. Option C with core 64,857, 64,859, 64,876. Option D with core 64,858, 64,857, 64,859, 64,876. As the given scenario involved the suturing of major peripheral nerve based on the type of the nerve being treated, we first eliminate option D with core 64,858 used for the suturing of sciatic nerve. Since the suturing is performed without transposition, we also eliminate option B with code 64,856 used for the same procedure but with nerve transposition, relocating it to the more suitable area nearby. In both remaining option A and C, CPT code 64,857 is used for suturing a major peripheral nerve without transposition. We eliminate option A with modified 51 used with an add-on code 64,859. Therefore, the correct option is option C with code 64,857 and code 64,859 is used for suturing of each additional major peripheral nerve. CPT code 64,876 is used for suturing a nerve that requires shortening of the bone of the extremity. A 37-year-old has multi-level lumbar degenerative disc disease and is coming for an epidural injection. Localizing the skin over the area of L5 to S1, the physician uses the transfemoral approach under fluoroscopic guidance for needle positioning. The spinal needle is inserted and the physician experiences presses into her left lower extremity. The anesthetic drug is injected into the epidural space. What CPT codes are reported? Option A with code 64,483, 77,003 along with modified 26. Option B with code 64,493, 77,003 along with modified 26. Option C with code 64,483. Option D with code 64,493. In a scenario, an anesthetic drug is injected into the epidural space. We first eliminate option B and D as in both options, code 64,493 is used for facet joint injection procedures. In both remaining option A and C, code 64,483 is used for injection, anesthetic agent, and a steroid transfemoral epidural with imaging guidance. Since imaging guidance is already included in the code description, we don't need to code it separately as stated in option A. Therefore, the correct option is option C with code 64,483. An injection is performed to anesthetize a nerve located between two ribs to block chest wall pain, which CPT nerve injection code is reported. Option A with code 64,415, option B with code 64,420, 64,421, option C with code 64,417, option D with code 64,420. In this scenario, an injection is performed to anesthetize a nerve located between two ribs. The space between two ribs is called intercostal space, and the nerves located in these spaces are known as intercostal nerves. The first eliminate option A with cos 44,415 used for an injection procedure performed on the brachial plexus area, a group of nerves in the arm. We also eliminate option C with cos 64,417 used for the injection procedure performed in the axillary nerve located in the axilla area of the upper limb. Since the injection is performed on a single nerve, the correct option is option D with cos 64,420. Thank you for watching. If you have any question or need further clarification, please feel free to write in the comment section. For more detailed guidelines, CPC mock exam related questions and notes, email me at the giving email ID.